throughout the human history, we have seen that almost half of the human deaths have been caused because of malaria, and that comes to roughly around more than 5 to 6 billion. But now we are on the verge of controlling all the malaria deaths, and malaria is on the way to elimination. I am Dr. Pranav, HOD Department of Public Health, and I welcome all of you to our SOMAS Evolution classes. This is an endeavor by GD Goenka University to create quality content that is available for everyone across the globe, freely available. So I hope you all benefit by subscribing to our channel. So today my discussion will involve talking about what kind of landmarks we all achieved at public health and what all potential lies for the future. My dear friends, public health is one of the baby sciences. If I talk about the history of sciences, physics have been very old, chemistry is very old, but public health has got a history of not more than 200 years to say. It started with John Snow. There is a very interesting story of John Snow. John Snow was an anesthesiologist and a very curious public health physician. At his time in London, around 1800s, lot of deaths were there. The condition of London was not so hygienic, the kind of London that you see right now. It was not the case in those times. The river was so polluted that the Parliament of Britain, they have to cover their window just to avoid the stink. And in those times, lot of deaths were happening in London. Diarrhea and fever was there. Everyone was perturbed, like how to control it. And you remember 1850s, when even antibiotics were not there, when we are yet to identify the agents behind the waterborne diseases. So in those times, our curious Dr. John Snow, what he did, he took a map of London, and on the map of London, he started identifying the different locations. So what he did, all the deaths, he created a pin for all the locations where the deaths were happening. Now the curious mind was further looking what are the clues. So one of the clues that he found was there was a water supply company, and the water supply company was taking water from riverside where the sewerage was being dumped. So he had an idea, why don't we complain about the water supply company to the authorities and stop the supply of that water supply company. Now just by stopping the supply of that contaminated water, all of a sudden there started reduced deaths, and finally there were no death, no diarrhea and fever deaths in London. And it was a small incidence for global history as such, but it started a big public health movement. It was the first time that without use of any medication, without use of any antibiotics, vaccines, we were able to save life. And here started a journey in the history of medicine, where the insight was that without even the use of antibiotics, without even use of surgery, we can save life, and save life in thousands. And here we are standing at 2022, where as Indian citizen and as global citizens, you will be proud to know that in India, malaria is on the way to elimination. By 2030, we are looking to eliminate malaria from the map of India. By 2027 only, we are thinking there will be 0 cases, and 3 years we will be doing active surveillance, and we will be ensuring that there is no malaria case coming from India. Apart from Sri Lanka and China, we will be only the 3rd country in our neighborhood which will be able to eliminate. And from my experience working in the training of malariologists and all the malaria cadre across India, I tell you, we are at right path. Malaria is on the way to get eliminated. Now, so is the case with tuberculosis, and our public health efforts of doing screening of tuberculosis. You will be surprised to know now government has got a facility. All the people who are suffering from fever and have got some initial symptoms of malaria and tuberculosis, they can be screened at government facility, all for free. There is no charge, and our government has now got the funds, got the infrastructure, got the manpower to do this screening and to find out whether the patient is suffering from malaria or tuberculosis. Our government also is providing completely free treatment for all the patients who are suffering from tuberculosis. And imagine the condition in the history. Lot of celebrities, John Keats, one of the finest poet in English literature, and himself being a medicine graduate, he has to leave the world because of tuberculosis very early on, even in his early 30s. And now we are on the way even to control and finally eliminate tuberculosis. So this was again one of the big public health victory. Another public health victory that needs to be celebrated is elimination of polio. Our polio program was one of the biggest success story across the globe, and such large population. Imagine the case of India right now. We are population of 140 crores, and still when the time polio program was going on, our population was roughly around 80 crores, but we still were able to provide polio vaccination to almost every kid. Even a kid, if it was in transport, if it was in train or say buses, every kid was spotted and every kid was provided polio vaccine. And finally, as community and as nation, we were able to eliminate polio, and fortunately every child who is now born in India has got zero risk of having polio. Same is not the case with our neighbors like Pakistan and Afghanistan. One of the deadliest spot of polio, it's still there in Pakistan and Afghanistan. But as society in India and as community, our proactive efforts in public health finally led to elimination of polio in India, considering our size. The another victory, and which we are very much part and parcel of at GD Goenka University, Department of Public Health, that's anemia elimination. We have got in India one of most powerful program, one of the most ambitious, that's Anemia Mukt Bharat. And in that part, we are associated and we are doing screening house to house in our neighborhood. We have got Bhondsi village, we are again going to Dhankot village. In these two villages, we are going house to house doing screening all the women who have got any symptom like tiredness, like they are feeling discoloration of skin. Our students are requesting them, the women are getting screened for their hemoglobin level. If hemoglobin level is found to be less, they are provided with counseling. If this level is very less, they are also provided with iron and folic acid. If it is dangerously low, then we also have ability to hospitalize them, provide them with complete facility. And this kind of pilot project, if they go successful, and I'm very much hopeful they will be successful, because we are getting great support at village. Almost everyone is being part of this program. By this, we are expecting we'll be able to create a model that in the effort, and we are planning this whole effort in 6 months. What is our plan? That within 6 months, we will be able to eliminate even anemia at grassroots level. And if we create such kind of model, this will be a very powerful pilot project which can be expanded across India for elimination of anemia. And like India, we have got almost similar kind of socioeconomic status if we talk about in South America, if we talk about say Africa. So we can eliminate the same and we can create the same model that can be replicated across Africa, across South America. All such things are possible because We are now continuously evolving. We are now continuously coming with new and dynamic features and coming up with a lot of researches and documentation to find out what were the best practices. This is one part, a great help and a great effort by public health people who are doctors, who are nurses, lab technicians, because as we know, public health right now is a multidisciplinary science. It gets huge support from students who are coming from multiple backgrounds, the students who are coming from pharmacology, students who are coming from lab sciences, students who are coming even from radiology or say Ayurveda and homeopathy background, apart from medical background students. Everyone are now coming together, coming with their unique advantages. Like the students coming from lab technology, they have got an advantage in public health because they can do great survey in finding out tuberculosis agent using microscopes. Nutrition students who as graduates have joined in public health, they are now able to make intervention in the community level, and they are able to work hard in controlling and eliminating the diseases. With such effort, we are now working so hard. Now, one part that is missing and where we need help of everyone, and why we are connecting with you as audiences, and everyone should now need to chip in, that is, we need to take help from the whole society. Because public health is one thing that demands support from everyone. Right now, public health matters most, especially in India and in developing nations where our per capita GDP is not that high. We cannot really imagine to create super specialty hospital for every citizen, every housing society, every village and every small city. For that, what we need to create is, we need a structure where people are aware about diseases which can be prevented. As we discussed in the first part, we are almost now on the verge of eliminating and controlling the infectious diseases. But some of the major diseases now India is facing is across the globe. Earlier it was problem of mental health, that was a problem of developed nations. But now even in India, our farmers are facing mental health problem. They are committing suicide, they are facing depression, our students, our working class. So mental health is one big challenge. The another one is diabetes. As we know, diabetic nation we are becoming, and now India has got a dubious distinction of being diabetic capital of the world. Same is the case with cardiovascular condition. So now we are having a lot of young people who are having an unfortunate end at the gyms, where you are going to get good health and now you are meeting an unfortunate end. Lot of celebrities, lot of famous people, popular people and youngster, they are meeting the deaths. So now the challenge is for all the community members, all the students, to create awareness in the society about obesity, which is behind cancer, which is behind diabetic condition, which is behind cardiovascular condition and mental health. As I said, public health is not just matter of doctors. Everyone in the society need to chip in. Public health is not a training, in my view, that should be given only to the students who are enrolled in Masters of Public Health program, the kind of program that we run, but rather right from school days, students should learn how to stay healthy, so that when they get into their adult life, in college and finally at workplace, they are able to control the chronic diseases. Because my dear friends, chronic diseases, they are big burden on the economy of nation. They need 5 to 10%. Like if you talk about America, the per capita budget of healthcare in every individual is roughly around 70,000 rupees. Such kind of budget we cannot afford. That's why I request everyone, all the viewers who are around looking at our program, Stay tuned to our channel, that is Soma's Evolution classes. We have lot of great insights for you that you can use in your day-to-day life, and I hope with our effort the quality content reaches everyone. If you haven't yet subscribed it, subscribe our channel, like our channel, and as we discussed, we have got insights that is very useful. Never forget to share with your friends and family. Let's make the world a healthier place to live, and as I discussed, public health matters and everyone have to make effort to make the world healthy. Everyone has to become a public health warrior. Thank you.